I'm now going to take you through each of the canine, premolar, and molar teeth individually and give you little nuances for each of the teeth in the dog and the cat with little techniques and tricks that'll help you get through these as quickly and efficiently as possible. Watch this, if you would please, first, and then proceed to the 4 videos in the next segment, which detail the maxillary and mandibular extraction of the canine tooth in both the dog and the cat. Today we are going to be detailing the surgical extraction of the canine teeth. The dog and the cat are almost identical as far as anatomy goes and our landmarks for our extractions. The only difference is the tissue management between the two species. When we look at the anatomy of the dog, we can see the white arrow pointing to the attached gingiva, which spans this from this line of demarcation down to the marginal gingiva here. This is all firmly attached gingiva to the bone by periosteum. Dorsal to that, we have the unattached gingiva, which is loosely attached with periosteum to the bone. And in the cat, we have a similar arrangement. The gingiva is much more friable and thin and very easy to traumatize in the cat, and certainly that holds true for the dog if we're not using the correct technique, but certainly more so in the cat. I do have a cat video that I will have as part of the resources for you on the page that I create with this recording, and you'll have a really good feel for cat maxillary canine extraction from that video. But essentially the technique is exactly the same and the incisions are exactly the same in the cat for both the maxillary and mandibular canine. So looking at the anatomy here and recognizing that this attached gingiva is what is literally holding the rest of that tissue against the tooth, we have to remove that mucogingival line that's here and get up this loosely attached gingiva in order to create a flap that allows us to have access to this area, because what we're going to be doing is we're going to be removing the vestibular bone off of the tooth root to expose the tooth root and make for a much easier extraction as opposed to what we'd be up against if we didn't take this approach. This is the easiest approach and the most expedient approach that I've encountered, and certainly that's based on a lot of trial and error over the early years. But I think you'll find that it is very simple once you've practiced it a little bit, and I don't expect you to be able to leave this webinar and go into the practice tomorrow and never have done any of these previously and be able to perform a surgical extraction in an actual patient. So you want to make sure that you have an opportunity to review the videos that we're going to have, to review this webinar if you've not had a lot of experience, and practice on a cadaver or several cadavers prior to getting up your skill level and also decreasing the time that it takes you to perform these. We talked about a lot of the landmarks that are involved with trouble areas in the previous webinar. There's really not anything that you can get in trouble with the maxillary canine extraction. Nasal cavity, but that's not a major problem. It happens quite often, and bleeding certainly can be excessive, but it generally stops by the time you've closed, and it's not a significant thing for the patient.